Thank you very much. Kia ora, vanakkam, good morning. After Trevor's wonderful planetary health place setter, I'm going to kind of distill down to the urban bit of today's plenary. And I'm really going to be talking about cities and how they determine the future of a lot of planetary footprint in global health today. So when you actually look at the pace of urbanization, it's quite phenomenal. And the graph basically shows cities and their projected growth by 2030. And if you look at the red dots, they represent cities with populations of over 10 million. In the Asia-Pacific region alone, about 120,000 people migrate to urban areas on a daily basis. And with that kind of movement, it's projected that 63% of the world's population is going to be in cities by 2050. And that's a huge shift of people to place. When you look at urban growth, you look at countries that are both developed and developing. And for this presentation, I'll focus a little bit on developing economies, especially South and Southeast Asia. And India has actually seen phenomenal urban growth over the last 20 years or so. A lot of that has been rural to urban migration, but a lot of that has been indigenous growth within cities. To qualify as a megacity, the UN has actually defined a megacity as one having a population of more than 10 million people. 7 out of the world's 10 megacities are going to be in India, or 5 are already there, and by 2030, 2 more are going to join that club. New Delhi kind of tops the pit here with 26.5 million people. Now that's a lot of people in a single place. If you look at urban density, which is the number of people concentrated into one geographic area, here too South Asia kind of takes the top spot with Dhaka, closely followed by Mumbai. And India alone accounts for about 11% of the world's urban population, and 50% of that population is going to be living in cities by 2030. So what does this really mean for planetary health, the growth and well-being of cities, and us as citizens of those cities, and what this is really going to mean for our own future? There's often a strong relationship between urbanization and income, and it's often seen that as countries get richer, they tend to become more urbanized. And if you actually look at India, China, and Indonesia, you'd see the large red circles where there is dense urbanization. But as cities get richer, there's also inequalities. And if you actually look at the share of urban populations living in slums today, if you actually look at the slum percentage from 1990 to 2014, there's actually been a decrease in the number of people living in urban slums, largely because cities are often economic engines of growth, and slum populations themselves work on an upwardly mobile trajectory in terms of per capita GDP and income. But having said that, for a population of 1 billion people, India continues to have a slum-dwelling population hovering around 17%, which is still a lot. So this leads to something called an urban paradox, and you see that in cities everywhere. You see one section of the population moving to cities as a part of an aspirational goal. You want to get somewhere, you want to leave something behind, you want to be better. And you have another section of the population who's already there, but wants to get higher still. So where does this stop? And what does this really mean for health in the long term? So what we essentially suffer from today is an urban effect. Cities multiply, both in terms of demographics and land area. They consume more electricity, they consume more water. They have to build more infrastructure to sustain these seething populations. There's more transportation issues because the more number of people getting from one place to another means more number of vehicles. And of course, there's pollution. So when you look at urban effects, it's really a multiplicity of migration, which in turn leads to a triple burden of disease, of non-communicable, communicable disease, and environmental health hazards. The expansion of city boundaries themselves and the creation of peri-urban areas, so agricultural land that eventually blurs boundaries and transfers into urban spaces. And then you have issues with governing those cities where municipalities are often in no man's land, where you don't know where your city ends and another begins. And at the end of this all, there's an absence of intersectoral coordination between urban planning and the very design and delivery of cities. There are about 370 million urban dwellers in India today, and 100 million of them live in slums. So where are we in terms of the SDGs? As far as India is concerned, we still have a long way to go. There's a high rate of pollution. We haven't gotten to where we need in terms of solid waste disposal. Child death and diarrhea continues to be a big issue. And so this brings me to an ongoing issue where cities have failed to cope with planetary and ecological changes. And that's the dynamism of a city, the design of a city, and the politics that lead to cities being eventually mismanaged. And this forms the heart of the challenge in many developing economies, where cities have expanded to a point where there is little governance beyond the core central areas of the city. So the growth of the city invariably becomes very organic. And when the city grows organically, one cannot seem to control how you want to design a city that is equitable as well as environmental and sustainable, and all the Anthropocene determinants of health that Trevor talked about in his previous presentation. If you look at this graph, this is a graph from the city of Bangalore, which is now known as the Silicon Valley of India. Bangalore is a classic example of uncontrolled urban growth. And if you actually look at 1999 to 2014, the expansion of Bangalore's built-up area, you'll actually see the red dots growing exponentially. Corresponding to that, from 1992 to 2000, if you look at the vegetation cover, you'll see how thin it has become. This also leads to the second point. One is, of course, urban density and uncontrolled growth, and the other is the inability to manage the expansion of cities. And this is a classic example of India's first private city. It's called Gurgaon. It's on the southwest border of the city of Delhi. It borders, it's in the state of Haryana. And the story of Gurgaon is really interesting. In 1970, when Delhi decided to stop selling land to developers, they ended up pushing them out into the suburbs. And around the same time, this was in the 1950s, and then in 1970, Haryana state, which borders Delhi, actually eased their land control act and allowed land acquisition. As a result of which, there was a spate of private developers who bought out land from the agricultural farmers of that area. They used to farm spinach and mustard and wheat. And as a result of which, there were large tracts of agricultural land that were then sold to developers. And over time, what you see in the picture here, an eruption of commercial and residential development. But what is very interesting is that up to 2017, Gurgaon did not have a municipal corporation. And that was largely because when Gurgaon changed its demographic from a rural area to an urban area by selling land to developers, in urban planning it still retained its status as a rural area, and therefore it had no urban municipal culture to take care of the many services that a city needs. So as a result, you have a private city that's owned by private developers, where solid waste management, water, electricity, and even firefighting services are provided by private entities, and that includes healthcare. So what you see here is a private firefighting service that the DLF builder, which is the Delhi Land and Frontier Development Corporation, has instituted for Gurgaon, because it's the only firefighting service that has high-rise suspension ladders to kind of spray the 21st floor of some glittering building should it catch fire. So that's the state of urban planning and the lack of intersectoral design in the country today. But what does this all mean for environments? And I'll translate that to health. And I'm going to give you an example of the city of Chennai, which is my hometown. And these are three urban events that happened in a sequence of a couple of years. So November 2015, August 2017, and August 2018 were years where Mumbai, Chennai, and Cochin in Kerala, these are coastal cities, had unprecedented rainfall. This has been happening over the years, but over the last couple of years, this has really, really increased. In November 2015, Chennai had 1 week of incessant rainfall, to the point in which the city was completely flooded. And the picture here you see is that of the Chennai airport. By day 3, the airport, which was a new terminal, had completely flooded out. You had 747 and 787 Boeings floating in water. And what was the reason for that? It was urban growth and development. In the expansion of Chennai as a city, one of the first things that urban developers ended up doing was to destroy the city wetlands, which were the natural sponges and the natural lakes and waterways that actually were able to catch and trap rainwater. And as a result of which, you had entire populations residing in low-level swamplands that were automatically flooded during the next rainfall. So as a result, you live in a crucible of a city that resembles a swimming pool, and 450,000 city residents were actually displaced as a result of this. So the way cities plan and expand have left huge holes in the ecological footprints that they are going to leave if we don't do something about it. But what does this all mean in terms of health? So, large rainfall, poor municipal capacity, seasonality of malaria. And once again, this is also linked to inequality. So we did a mapping of malaria incidents, and May through September is the usual time when there's maximum rainfall. There's a spike in malaria cases, and a regression analysis shows that's closely correlated with the population of slums in that region, along with lag falls of rainfall. Urban environments. Delhi has the distinction of being one of the world's most polluted cities, and India holds the singular distinction of 25% of premature deaths from air pollution. Based on the recent Lancet report. 16% of all deaths worldwide, and 25% comes from India, and the particulate matter and ozone pollution from city air. If you look at comparative studies between South Asia and India, again you can see chronic respiratory disease and COPDs climbing up the ranks when it comes to non-communicable diseases and incidence of deaths. So who really defines an urban ecosystem, and where are those power struggles happening? The municipal government has the biggest power. It has the power to define cities, but it also lacks capacity and resources to manage peri-urban growth and activity. And that is a singular challenge that's happening in many, many cities in developing economies today. In addition to that, you have the private sector, you have multilaterals, and you have local citizens, all of whom need to come together to be able to tackle some of these long-term issues on health. So what is the impact of urban social determinants on primary health? Everything. You have environmental concerns, you have issues around housing and shelter, you have violence, you have crime, substance abuse, climate change. But actually the biggest problem is urban poverty. So as cities grow richer and as people go more aspirational, one of the biggest impacts on health and primary health is poverty. One of the most striking disparities that in cities is that of health status and outcomes, and this is especially so when you were looking at urban India. An urban advantage in health was found when we compared averages between urban areas and rural areas. But when we actually investigated health indicators within urban areas, there was significant heterogeneity. So one of the things is that the probability of both child stunting and mortality decreased monotonically with increasing wealth. And this was more common in slum and non-slum communities. So people who were poorer had a greater propensity to grow up stunted and sicker and die faster than those who were not. Similarly, when we looked at child morbidity and mortality in rural and slum dwelling tenements, the same thing. The predicted probability of stunting among the urban poor was far more than urban populations who were not. So urban health penalty echoes in other indicators as well. Under 5 mortality rate is still significantly higher. 60% of the urban poor children receive complete immunization, that's just 60%. 47.1% are underweight. 59% of urban mothers are anemic. And 81% of urban poor households are without piped water. All this impacts the way primary health outcomes are delivered as well as serviced in urban economies. So what are the policy implications that have kind of led to this? Well, India essentially started out with a massive drive for urban primary, for primary healthcare with the National Rural Health Mission. So primary health was essentially seen as a rural prerogative. That was where a $4.5 billion budget was targeted. And as a result of which urban health or urban primary health care with all these determinants was largely neglected. In 2013, there was a merger of the National Rural and the National Urban missions, and that's what's created the National Health Mission of today, but it's again grossly underfunded. And the capacity to be able to address urban primary care is very, very fragmented in the country today. There are other policy initiatives like the Swachh Bharat mission, which I think was tremendous with the NDA government. This was the first time a government actually looked at urban sanitation, and there was, as well as rural sanitation, and there was a huge drive to create the use of toilets, the constructions of toilets, and to prevent open defecation in the country. This policy initiative is still being evaluated, so that's still up in the air. And last but not the least is the Smart City mission, where 500 cities were chosen for urban infrastructure and digital health solutions, and that's something that the government continues to invest in. So, the fundamental problem with urban health systems in a country like India and many other cities in South Asia is the governance mechanisms, which are often very, very polycentric. And urban health policies are often split between central and local authorities. And as a result of which, urban planning is very seldom collated with urban health. Urban planners very rarely interface with public health and municipal commissioners in relation to health. And as a result of which, the most vulnerable populations in urban spaces are often left behind. Quality of services provided at public health facilities are also a huge barrier, and without the ability of a municipal corporation to evaluate parameters like infrastructure and hygiene and access, a lot of these proposals or projects are bound to fail. And finally, I'd like to go back with the singular tenet that in order for cities to survive, they have to be able to be governed properly. And systemic gaps in governments are invariably going to show up in the way health indicators are projected in many of these urban areas. So primary health provision in urban municipal corporations in India are under the ambit of the municipal corporation. We have primary health clinics, but actually, when you actually look at the way urban systems evolve, it looks like this. It's a bit of a mess. So you have private players, which are organized, informal, NGOs, and then you have a public system which has your vertical programs, your central and state government, insurance schemes, and so forth. But the result of all this is a complete gap in primary healthcare services in the country. 80% of all outpatient care in urban India is delivered privately, and 40% of all inpatient care. Now that's a big number, and one has to be worried about it. Complex urban governance structures. These are the structures of 3 municipal corporations, and as you can see, they're a messy lot. And it's often hard for municipalities to even address basic problems when there's a lot of capture and corruption right at the top. But there's always hope at the end of the tunnel, and I wanted to focus a little bit on urban resilience and the role of social innovation. So when you look at environmental factors, the mismanagement of cities at large, the lack of interface between urban planning and health, communities have to come together. And here are a couple of really interesting initiatives that are happening across the city. So one is the Kriti Clinic and the Slums, the integrated PHC. These are 2 different entities happening across different cities. And they supply what are called urban primary integrated services in urban slums. So they basically act as sourcing agents for different areas of primary care, whether it's diagnostic services, the dispensation of generic medicines, and simply having a doctor and a nurse in a slum settlement to basically look at screening, health promotion, and first line of care primary services. They've actually expanded considerably and across all of Hyderabad and now many places in Telangana state, and the Mumbai clinics have now expanded to other tier 2 and tier 3 cities in Maharashtra. The other big success is the Mohalla primary clinic, and this is where communities really come into being. So this was the brainchild of the Chief Minister of Delhi, which is a union territory, and he said, why not I go to the communities and ask them, what is lacking in primary health care where cities are concerned? And so they ended up building these neighborhood clinics on, believe it or not, donated land from the community. This is private land, it's not government land. There are about 108 clinics so far. They are housed by a doctor, they perform a state of basic diagnostic tests, and they are linked to municipal hospitals in Delhi. Then you have other community-led innovations that impact primary health. And there's one private and a couple that are municipally led. The Parivartan Slum project in Gujarat is another great example. This is where the Gujarat Mahila Housing Association, which is a community of women, got together. And they took certain areas of Ahmedabad city that had huge slum settlements. And what they did was that they worked with the municipal corporation, brought in other private sector partners and NGOs, and tenured the slums for 10 years. And under that tenure, the slums got water, sewerage, solid waste disposal, and electricity for a small payment that the slum the slum inhabitants ended up paying to the municipal commissioner. But as a result of that, the slums kind of morphed from being squatters' colonies to actual inhabited spaces that had all the basic amenities that a city should have. So this was a great project, and this is actually being replicated now in some of the other cities. The other was the Ahmedabad Heat Action Plan, and this is where PHFI was closely involved. Ahmedabad is another city in Gujarat that has huge heat waves. Their temperatures soar to 40 to 45 degrees centigrade during the summers, and as a result of which there was a lot of premature mortality in the cities during the summer months. So we actually collaborated with them, and I made the Ahmedabad Heat Action Plan, which is basically a temperature forecast monitoring mechanism that the Ahmedabad Municipal Corporation works with communities, and as a result provides community-based responses to heat waves. And the last one is drinking water. One of the biggest challenges in urban slums is the lack of drinking water or piped water. This is a social innovation that was done by the Urbanisation Foundation. And basically, for 5 rupees, you can get 1 liter. For 20 rupees, you can get 30 liters of clean drinking water that are provided through these water ATMs. There are about 20 states that are now participating in this initiative, and about 25 million people are currently covered. So there are other innovative health models in primary care. You have the PPHC model, which is a Hyderabad-based PPP in Andhra Pradesh. You have Rural Health, which is low-cost diagnostic services, again in slums. All of which are working now as discrete innovations. But one of the challenges is how do you end up integrating them? There are other urban innovations and efficiencies that are using digital technology, grievance redressal mechanisms, and so forth. So at the end of the day, when you talk about planetary health and sustainable healthy cities, I think there's a combination of solutions that need to be addressed, and scaling will remain a challenge across many of these solution spaces. One is to look at policy-based solutions to rethink and include urban and peri-urban ecosystems in the planning process. The second is to look at market-based solutions, carbon taxing, pollution taxing, and so forth, risk mitigation. The fourth is to look at community-based solutions to bring communities at large together. Yes, I know, I'm wrapping up. And the last is technology-based solutions, which are a little like what I showed you, that kind of address individual primary health problems, but whether it's a chair in a room in a house in an environment, or an environment in a city plan. Thank you very much.